lot of times when we walk into a clinical space or a patient lounge or what have you, it was functional. So there was a lot of chairs, there was the amount of seating that you needed, you know, every seat was the same. Even the fabrics were very clinical, you know, easy to wipe down, things like that. I think now what I'm seeing as a trend is people are trying to create a feeling from their patient lounge. Softer fabric, deeper seating, things that envelop you, not just a very rigid armed chair, but something more that feels like an actual lounge, somewhere you're comfortable to sit, actually can make you less apprehensive. Yeah, for sure.
And I know yesterday we had talked about going down the hallway.
Materials as we go down the hallway, you know, talking about that apprehensive patient, you know, that walk down the hallway can be very anxiety inducing, you know. It is. You don't know really where you're going or where you'll end up. You're thinking about all the things to come. So just the change in material, the way, you know, there's wall covering on this side, but then there's things to look at, actually takes your mind off of the fact of the end result, you know. Beautiful artwork, even just little details that give you something to take in and keeps your mind occupied so that you can relax. It's just another form of relaxation.
Elements of interest that kind of capture and kind of distract you on your way. I feel like that's the point of what we do, is controlling the psyche of the patient as they're interacting with the space. In the front areas, I feel like especially because that's where you get the most control with how you can make the space feel. It's the most lenient, I guess, in terms of like spaces in a dental practice. The most important thing is, like, when we're doing a consult call with a client, really trying to get to the bottom of their vision of the space. My first question, and the question that I kind of drive throughout the whole thing, is how do you want the space to feel? How do you want your patients to feel, and how do you want your staff to feel in the space? Of course, it's important for your patients. They're interacting with your space. They're the ones that are keeping your space alive. But your team members spend, I mean, just as much time there as they do home. So making sure that your space is comfortable for them, along with your patients, I think is important. And not that I don't care what you like in a space, if you like gold or silver, but we'll get to the bottom of that. But we need to keep the feeling as kind of the heartbeat throughout the entire discussion.
Yep. And even, you know, thinking beyond of how a material looks is how it functions in the space.
Absolutely.
These wood panels are actually bouncing sound and dampening the sound within the hallway, as well as the carpet through that space.
And the ACT ceiling as well.
Yes, exactly. So as noises and the drilling sounds that are coming out of the operatories are actually being dampened by any of these materials. So we think that through as well. Not only does it look great, but it's also super functional.